If you like the video, I would again emphasize, press the like button, share the video, subscribe to the channel and press the bell icon to get all the updates about the new videos.
Hello guys, let's learn today how to examine patients. So let us start now. First of all, you will check for higher mental functions. So this is the patient who is sitting cooperatively, which is conscious, alert and cooperative, which will tell about mental status. Speech you will examine, cranial nerves 1 to 12 you will examine. Build and nutrition are important things, but the difference you should be aware of. The build is skeletal framework of the patient like this. The nutrition is proportion of the soft tissue structure in relation to bony structure like this. So Decubitus says position of the patient in the bed. So the patient is like comfortably in the bed. The pallor, you know the indication of anemia. It is pale pallor of the skin. Now you should know where to look for the pallor. It is lower palpebral conjunctiva like this. Mucous membrane of the lips and the cheeks, this. Nail beds like this, and palmar creases. These are the spaces or the places where you look for pallor. You will also look for icterus and the jaundice. So what is jaundice? It is yellowish discoloration of the skin and the mucous membrane. It occurs due to presence of excess bile pigment in the plasma. Now again where to look for jaundice? These are sclera of the eye. This is white sclera of the eye. Nail bed and the lobule of the ears, you know that. This is the lobule of ear. Here you look for jaundice. Tip of the nose, that is important site. Under surface of the tongue, that is also important site. Now you should also look for cyanosis. So what is cyanosis? It is bluish or purplish tinge of the skin and the mucous membrane. It results from the excessive amount of reduced hemoglobin in the underlying blood vessels. So peripheral cyanosis is due to poor perfusion of the blood vessels. So the blood vessel perfuse poorly, which give rise to peripheral cyanosis. The central cyanosis is a reduction in the oxygen of the arterial blood. So it is defect at the heart or the lung level. Now there must be at least 5 gram of reduced hemoglobin for cyanosis to be observed. So it may not be present in severe anemia. You must be aware of this because at least 5 gram of reduced hemoglobin should be present. So look for peripheral cyanosis. Where to look for? Nail bed, tip of the nose, skin of the palm, toes, you know that. The central cyanosis should be look at the tongue, nail bed, tip of the nose, skin of the palm and the toes. So clubbing, you should also look for the clubbing. This is what? This is bulbous enlargement of the soft part of the terminal phalanges with both transverse and longitudinal curving nails. See here, it is bulbous enlargement and it is curving laterally also and transversely also. Now it is due to interstitial edema and dilatation of the arterioles and the capillaries. There are 4 gradings. The fourth grade is called Shamrock sign. It is disappearance of the diamond shaped gap between the nail when the fingers are opposed. So this is in normal condition. You will see a diamond shaped structure, but loss of this is called as the Shamrock sign. Now lymphadenopathy is also very important. It is what? It is disease of the lymph node in which they are abnormal in size, number and consistency. You can see here is a lymph node which is cervical lymph node, and also you have to look for edema. It is collection of fluid in interstitial spaces or the soft tissue. Now we come to the general physical examination. So you examine the patient from head to toe. Local examination, like if you want to concentrate on abdomen. This is the abdominal examination. Systemic examination and rest of the examination except the local examination. Provisional diagnosis you have to make. Then you have to make a differential diagnosis. Then you have to make a final diagnosis. GPE, that is general physical examination or general survey. What are the points? These are mental status. You know that. Build and nutrition. You know that. Attitude and decubitus. The patient position. The faces. The performance status. Pallor, icterus, cyanosis, clubbing, lymphadenopathy, edema, you know that. Neck veins should be examined, blood pressure should be taken, pulse should be taken. Now respiratory rate should be taken, temperature should be taken, and obvious deformity if present should be noted down. So we usually start a sentence when we present a case with The patient is well cooperative, oriented to time, place and person, lying or sitting comfortably in bed. like this, well built or thin built, you know that, good or poor nutrition, this is nutrition. Pulse, for example, is 72 per minute, blood pressure is 120 by 80 mmHg. This is how you examine for pulse. It should be by three fingers. The pickle is a mnemonic for pylorictaris, cyanosis, clubbing, lymphadenopathy and edema. So this is the pickle, but the spelling is different. Neck veins, you should be examining this. Respiration, for example, it is 14 per minute, that is thoracoabdominal or any decubitus or obvious deformity. Local examination, you will be examining the affected region. Inspection is just look at the patient and just try to make a diagnosis or analyze the patient. And palpation, it is feeling by hand of the affected part. Percussion, you know that you tap the affected area and get a clue about some diagnosis. Auscultation, listening to the sound with the stethoscope. Now systemic examination is what? Examination of the system other than mentioned in the local examination. Examination of abdomen, what will you see? Position of the umbilicus, presence of scars or dilated veins, visible peristalsis or pulsations, herniation or genitalia. So this is the abdominal examination. Respiration examination is shape and movement of the chest, respiratory rate, note on percussion, normal added breath sound are also recorded. Cardiovascular examination, there should be heart rate, S1, S2, apex beat, any pulsation, any thrill or any murmur should be examined. Examination of nervous system will include higher mental function, motor as well as sensory examination. Any history and examination, you have to make a provisional diagnosis. So you have to think about the provisional diagnosis. If you make a rare diagnosis, you are really correct. So do not make a diagnosis of this tiny star when you can have these things as your differentials. After routine and special investigation, you have to make a clinical diagnosis that should be conclusive. Thank you.